In California, overdoses are the #1 cause of accidental deaths and surpass homicides, car accident deaths, and alcohol-related deaths.
These numbers are unacceptable.
Overdose prevention programs have been used successfully around the world for over 30 years, and the results are transformational. Now is the time to vote yes on SB 57 to save lives and provide a pathway to treatment.
SB 57 would allow Oakland, San Francisco, and Los Angeles to pilot and evaluate overdose prevention programs, which have already proven highly effective in Europe, Australia, Canada, and have recently opened in New York City.
There has never been an overdose death at an overdose prevention program site.
Local leaders support this pilot program as an opportunity to gather vital data on how these programs can best be implemented here to help address California's public health crises of drug use, drug overdose, and homelessness.
According to the American Medical Association, studies from other countries have shown that supervised injection facilities reduce the number of overdose deaths, reduce transmission rates of infectious disease, and increase the number of individuals initiating treatment for substance use disorders without increasing drug trafficking or crime in the areas where the facilities are located.
The California Society of Addiction Medicine is sponsoring SB 57 because as medical professionals and the experts in drug treatment, we strongly believe these programs are an integral part of the treatment continuum. They provide an entry point into treatment for the most at-risk patients.
The overdose crisis is a racial equity issue and disproportionately impacts BIPOC communities. In Los Angeles, accidental drug overdose deaths have increased by 75% among Asian communities, 68% among Black communities, and 55% among Latinx. This bill should absolutely move forward. I can attest that the research from around the world is overwhelmingly supportive. Programs authorized under SB 57 have been proven to reduce not only death by overdose, they also reduce hospital use, emergency room use, paramedic use, public drug use, and litter related to drug use.
The research shows that overdose prevention programs do not increase crime. We recently conducted a study which examined whether an unsanctioned overdose prevention program operating in the United States affected local crime rates. The results were clear. Criminal activity decreased rather than increased in the area around the overdose prevention program in the 5 years following its opening. We also conducted a study in San Francisco which showed that each dollar spent on overdose prevention programs would generate $2.33 in savings.
As someone who has experienced addiction treatment as both a client and provider, I stay abreast of the most current research, and I know about what works and doesn't when it comes to working with people who are experiencing homelessness and use drugs. We need overdose prevention programs here in California to provide an entryway into drug treatment and access to housing and medical care. That's why the California Association of Alcohol and Drug Program Executives and Health Right 360 co-sponsored SB 57. We only ask that California lawmakers follow the science and give us a chance to pilot and evaluate programs that have already proven so effective in more than 160 sites worldwide.
Vote yes on SB 57.